Members of the Parliament and dear colleagues, it is an honor for me to participate in today's important event taking place during the month of the World AIDS Day and, of course, the 75th commemoration of the Universal Declaration of Human Rights. In my daily work, I'm a medical doctor, and in the fulfillment of my mandate as Special Rapporteur, I adopt an anti-racist and anti-coloniality framework to analyze the power dynamics in global health. My interventions are based on intersectional approaches, and I do so raising awareness on human rights, setting human rights standards, participating in dialogue, government and judicial processes, and in reporting to the Human Rights Council and the General Assembly. I also engage with regional mechanisms in the provision of technical cooperation and to exchange on good practices. The right of everyone to the highest attainable standard of physical and mental health should be analyzed from a broader perspective than the right to receive timely or appropriate care. But it encompasses the right to underlying determinants of health as well. The right to health is also interconnected with other rights, such as the right to work, education, information, the right to freedom and security of the person, the right to equality and non-discrimination, and the right to bodily autonomy. Dear members of Parliament, I would like to begin this intervention by stressing that sex work is work. Several United Nations mechanisms, including special procedures and treaty bodies, including UN agencies, have expressed concerns about the negative impact of criminalization and the punitive legal frameworks and public policies that exist on sex work. The application of criminal law in areas related to consensual sex between adults, including sex work, is inconsistent with international human rights law. Sex workers worldwide are affected by violation of their human rights, including widespread discrimination, arbitrary detention and arrest, as well as violence by state agents and private actors, lack of access to health and social services, impeded access to justice, and interference with their private and family life, as well as exclusion from civil, political, and cultural life. I support the position of the Working Group on Discrimination Against Women and Girls, as reflected in their policy paper issued in September, which focuses on the principles of equality and non-discrimination, agency, bodily autonomy, privacy, and free decision-making, and the need to ensure that sex workers' human rights, including the right to equality and the highest attainable standard of health and freedom from violence, are fully respected. Regrettably, so far, states are failing in guaranteeing that sex workers fully enjoy their human rights without discrimination, including their right to health. Sex work is also a gender equality issue because discriminatory use of law, criminal law, and the enforcement of punitive provisions regulate women's control over their bodies. It generates stigma and discrimination and violates women's human rights. It infringes on women's dignity and bodily autonomy to make decisions about their own lives and health. And this is contrary to international human rights law. Women sex workers are likely to face deprivation of liberty because of laws and social attitudes that seek to control women's morality and sexuality. And taking into account that women sex workers are therefore disproportionately affected and targeted by law enforcement agents, including where sex work is not a criminal offense. In this regard, based on the mandate entrusted upon me as a Special Rapporteur on the right to health, I would like to stress that some of the health concerns specific to sex workers are because of criminalization. In my daily work as a medical doctor, I provide comprehensive healthcare to sex workers based on their needs, which include HIV prevention or treatment, screening for reproductive cancers, screening for other sexually transmitted infections, trauma counseling, contraceptive provision, as well as safe abortion care. Yet, through differential access to healthcare and underlying determinants of health, socioeconomic and other structural factors, they interact with each other to generate and reinforce negative health outcomes that disproportionately affect sex workers. Earlier this year, my mandate issued a communication to the Republic of South Africa in support of the process on criminal law amendments that aimed at the decriminalization of sex work in South Africa. In that communication, I recalled to the state that HIV has been disproportionately affecting sex workers. And in this regard, in 2019, female sex workers were 30 times more at risk of acquiring HIV than general female population, approximately 8% of the new adult HIV infections globally are among sex workers of all genders. In 2016, the UN Secretary General affirmed that decriminalization of sex work can reduce violence, harassment, and HIV risk. And he called on states to remove laws, policies, and practices that violate human rights, including criminalization of sex work. Last year, in my report focused on the impact of violence on the right to health, presented to the Human Rights Council, I stressed how criminalization of sex work enables abuse, exploitation, extortion, and intimidation by clients and police. In September 2021, I sent a third-party intervention to the European Court on Human Rights in relation to the MA and others versus France case, cautioning that criminalizing sex work violates the right to health of sex workers. And in September this year, I welcomed an update from the court that they will hear the appeal against anti-prostitution law, which criminalized the purchase of sexual acts by their clients, and I really hope that the court will rule in favor of human rights. In addition to the UN mechanisms, and to name a few, UN entities such as UNAIDS, UNFPA, WHO, the ILO and UNDP, and the World Bank, they've all called for the full decriminalization of voluntary adult sex work. In addition, 12 UN entities, including among others, UN Women, UNICEF, the Office of the High Commissioner for Human Rights, and the ILO, recommended that states must review and repeal laws that criminalize or otherwise prohibit adult consensual sex work. In this regard, it is clear from the UN system and UN mechanisms that there is an urgent need to decriminalize sex work with the aim to protect sex workers' human rights, including their right to health. Dear members of Parliament, I wish to also stress that sex work should not be conflated with trafficking in persons for the purposes of exploitation, for labor or sexual abuse, amongst others, and that there are laws that already exist in relation to trafficking in persons, and those must be implemented and adhered to in full. However, sex work cannot be collateral damage to the deliberate conflation, because sex work by definition should be consensual and between adults. Positioning sex workers as victims or trafficked persons denies their autonomy and agency of sex workers. In her report to the General Assembly, the Special Rapporteur on Trafficking in Persons noted in how many countries anti-trafficking laws have been used to repress sex work, which have resulted in further violations in the rights of women, including restrictions on their freedom of movement as well as migration. Furthermore, discriminatory laws against LGBTIQ+ communities, restrictive migration policies, conflation of sex trafficking and sex work, racist and anti-LGBTQA+ views, coupled with socioeconomic injustice, contribute to the disadvantaged position of sex workers, in particular, trans women, migrant sex workers, and members of racialized and also ethnic minorities. States have an obligation to ensure for all persons on a sustained and equal basis the availability, accessibility, affordability, acceptability, and quality services and information for health, treatment, care, and support. Dear members of Parliament, there must be a collective vision and action for the world, where regardless of the conditions that places people in vulnerable situations and leads to marginalization, that the right of everyone to the enjoyment of the highest attainable standard of physical and mental health is respected, protected, and promoted. Sex work is work, and we know that legal frameworks and legislation that continue to criminalize sex work, sex workers, and their clients are against human rights principles. The only way forward is for the decriminalization of sex work in full. It is a human rights issue rooted firmly in international human rights. I thank you.